Whatever care that you're giving to a patient is universal, is equal to every person. It doesn't matter if you're in a private or a public hospital.
What we're trying to do is change the culture of quality in public facilities where the majority of women in Kenya deliver. And we do that by bringing knowledge to them in their context and working with providers over a period of time to improve their knowledge and skills around emergency and newborn care. Data from Kenya shows that providers tend to score less than 50% on emergency obstetric and newborn knowledge. And what typically happens is that people get taken out of their facility to go to a training, maybe for 5 days, which is quite expensive. And then they go back to their facilities.
In our initial assessment, we found out that there's a lot of gaps in skills, despite that we have trained some nurses. But still, the quality of care they provide is one thing.
We did the nurse mentorship program in which we train qualified, experienced nurses to not only be an outstanding nurse, but to be a coach and a teacher and a mentor to other nurses in public facilities. So they go multiple times a week and spend the whole day in maternity wards with nurses in public hospitals, showing them how the gold standard of delivery and newborn care is done, but also working with them in simulated emergencies and reiterating the skills that are necessary.
I must say that actually after having been supervising, yet I have not worked in a labor for long, I realized that there are a lot of things that we can actually do to be able to save this man and save the child.
We are able to go through with them in their challenges so that when we are dealing with them in mentorship, we know and we understand what they go through. So at least we have some time with them. We don't just train them and leave them behind, but we go through with them in their challenges and be able to guide them accordingly.
So the training center will be able to bring up more mentors who are going to dispense the knowledge that they get from Jacaranda Health.
To be able to have a gold standard place where mentors can feel safe, experiment, run simulation drills, and practice being a facilitator has been really helpful in developing a pipeline of future nurse leaders who will be going to public facilities and mentoring their peers.
As a person, you really also need to build confidence. You really need to get the knowledge and skills.
In a valley surrounded by the Himalayas, there are thousands of women who struggle with unsafe living environments, lack of access to education, and little economic opportunity. Each woman has a different story. Most women were never given the opportunity to step into a formal classroom. Many women dropped out of school because of marriage. For women in Surkhet, opportunities to make a living and have a voice in their community is limited, almost non-existent. At BlinkNow, our mission is to empower Nepal's children with a children's home for 40 and school for 400. BlinkNow is providing opportunity for children to have a brighter, healthier, and happier future. After 7 years in operation, we knew we had to empower the caretakers of our children to create a stronger and more sustainable future. In late 2013, the Women's Center opened its doors, and in January 2014, because of a $40,000 grant from Dining for Women, we successfully piloted the center, instructing sewing and tailoring. The Kopila Valley Women's Center serves at-risk women in our community with life-changing vocational and empowerment trainings. We believe that investing in women creates healthier families, more prosperous communities, and more peaceful nations. The Women's Center offers something uniquely special, a safe place to learn, create, grow, and heal. Within our walls, friendships blossom, and women of all ages and backgrounds come together to support each other. When we talk to Women's Center trainees, we hear a story of abuse, deprivation, and loss. 94% have experienced domestic or gender-based violence. 97% have little to no knowledge of their legal rights. 32% have had no access to education. 51% were married before the age of 18. Behind each of these numbers is a vulnerable yet powerful woman. She may have been married at a young age and unable to go to school, but now she pursues an opportunity to learn. She may have endured an abusive childhood, but now she demands a better future. Our empowerment course covers topics including self-confidence, self-advocacy, health and wellness, women's rights, basic math, writing, and business skills. Each trainee has access to counseling services, including meditation, legal support, and trauma care. We open day-long empowerment workshops to the community to increase the reach of our impact. Over 250 women in Surkhet have attended workshops on topics including family planning and reproductive health, women's rights, and entrepreneurships. We were overjoyed to hear BlinkNow had been chosen as sustained grant recipients. Our Dining for Women partnership helped us to establish the Women's Center, and we were so grateful for your continued belief in our mission. With the Dining for Women Sustained Grant, the Kopila Valley Women's Center will be able to continue to grow and enhance job trainings and empowerment courses. Our goal is to enable women to find independence, and that takes long-term, loyal support like the Dining for Women grant to accomplish long-term sustainable change. We love seeing our graduates start their own businesses, whether it's new tailoring shop or vegetable stand in the market. Of recent graduates, 100% reported an increase in income. Our graduates demonstrate that education is the best way to break down social and economic barriers. When women are educated, the risk of exploitation is reduced, marriage and childbirth are delayed, and labor force is more productive. We provide the tools, but it is the strength of these amazing women that drives progress within our community. That is the true magic of the Kopila Valley Women's Center.